Hello everyone. Today's topic is the artificial respiration and the resuscitations method. So first of all, there are what is the artificial respirations? Artificial respiration is a nothing but is a cardiopulmonary resuscitations, respiratory therapy, breathing, prone and pressure method, mouth to mouth respiration, and also the type of prone method, Holger method, Sylvester method, mouth to mouth respiration. So in the artificial respiration, breathing induced by some manipulative technique when the natural respiration has ceased or stopped or is faltering. Such as technique, if applied quickly, probably can prevent some death like drowning, choking, etc., strangulation, suffocation, carbon monoxide poisoning, and electric shock. Due to this, the respiration is not in proper way, or we can say the technique when natural respiration has stopped. Okay, and what is the resuscitations? It is the inducing artificial respiration consisting chiefly of two actions. First is the establish and maintaining an open air passage and from upper tract like mouth, throat, pharynx to the lungs, and the second one is the exchanging air like carbon dioxide in the terminal air sacs of the lung while the heart is still functioning. And to be successful, such effort must be started as soon as possible and continue until the victim is again breathing. So the next one is the Holger Nielsen method. In this method, the Sylvester method, the victim was placed face up and the shoulders were elevated to allow the head to drop backward. And the rescuer kneeled at the victim head, facing him, grabs the victim wrist and cross them over the victim lower chest. And the rescuer rocked forward, pressing on the victim chest, and then backward, stretching the victim arm outward and the upward. And the cycle was repeated about 12 times per minute. It's this process is also known as the prone's position. So the doctor kneels near the patient head facing toward him and he pull his arm up, and this will bring about inspiration. The doctor will leave its hands on one side and palm on patient's scapulars and bending forward, and will apply deep pressure on his chest. This is called expiration. So the next one is the mouth to mouth respiration. Is a very common method. In this method, the first put the patient in a supine position and clear airways and extend the neck, and then nostril is closed and apply your mouth to the patient or subject and exhale forcefully. Look for chest expansion and add distension, and this process is repeated from 10 to 15 minutes. And in this respiration, after the most widely used method, already discussed these things, and the person using mouth to mouth breathing place the victim on his back, clear the mouth of foreign material like mucus, and already they clear the airway. So the person using mouth to mouth please clear her mouth foreign material like mucus, and places his own mouth over the victim mouth. In such a way, establish leak-proof seal and clamps the nostrils. And this process is repeatedly 10 to 15 minutes. Next is the Schaeffer's method. In this method, a letter combined with the rhythmic chest compression that discovered by the American electrical engineer William B. Nonhoven and colleagues to restore circulation, and giving rise to the basic method CPR, cardiopulmonary resuscitations. In 2008, after researcher determined that mouth-to-mouth resuscitations too often, and they resulted in slowed or stopped circulation, or hand-only method for adult victims, which uses only continuous chest presses, was adopted by the American Heart Association. And in this process, it is also prone pressure method, and if there are injuries to thorax or back, this method can be used. And also it has disadvantage also in this method. Inspiration is passive and expiration is active, which is unphysiological. And if there are injuries of the abdomen, this method cannot be applied. So thank you.